So good morning class. I'll be discussing to you our module 3 which is vital signs taking. Okay? So what is a vital signs? So vital signs is a measurement and interpretation of the vital signs, or the vital signs are important components of assessment that can yield information about underlying health status. So client teaching concerning the vital signs is a key aspect of health promotion. So meaning vital signs is the baseline data of our health promotion or of our health strategy to our patients. So what are our vital signs? So it is composed of the body temperature or the pulse, respiration, and blood pressure. So indicate the function of the body's homeostatic mechanism. Homeostasis is the meaning it is the state of having a stable body function of our body. So meaning stable yung mga different vital signs natin. Okay. So first that we will tackle is, so the first thing na pag-uusapan natin is temperature. So what is a temperature? So human are warm-blooded creatures, okay? We are a warm-blooded animal as what they have said. Kaya nga minsan, di ba, paborito daw tayong kainin ng mga pating kasi ang mga pating gustong-gusto na ang mga warm-blooded animal. Human, which is a mammal, is considered as a warm-blooded animal. Okay? So, the normal body temperature when measured orally usually ranges about 36.5 to 37.5 degrees centigrade or 97.6 to 99.6 degrees Fahrenheit. This state of normal body temperature in a client is termed afebrile. Okay? Afebrile meaning the absence, pag nalalagyan ng yung isang term, meaning that is absence or absence of fever. That is afebrile. Okay? So when temperature exceeds to 37.5 degrees centigrade, this is termed pyrexia or febrile. Okay? So meaning you have a fever. Nilalagnat tayo. Okay? So body temperature can fluctuate in different form, in different may mga different situations. Like for example, exercise. Pag nag-exercise tayo, isn't it that there is a rapid heartbeat of the body? Okay, there is an increased level of the what we call epinephrine and norepinephrine, which is responsible for the beating of the heart. So pag lumalakas yung beating ng puso natin, there is an increased pressure of the blood and the blood is considered as warm. Meaning, umiinit tayo. Kaya nga nagkakaroon tayo ng flashes. Okay? Kaya nagbablush ka pag, di ba? Pag nakikita yung crush mo, biglang mag-iinit yung katawan mo or nagkakaroon ka ng mga blushes or flashes. Okay? Next is changes in hormone level. So, yung hormone level natin. Okay? For example, yung mga dalaga. Okay? Mga girls. Pag nagkakaroon kayo ng menstruation, isn't it na nagkakaroon din ng elevation ng body temperature ninyo. Isn't it? Okay. Nag-change din ang temperature. Next is changes in metabolic rate. This is because of the metabolism of the food that we eat. Okay? Because the food that we eat will be converted into energy. Kaya nga ginagamit natin yung mga pagkain natin para makagalaw-galaw tayo at makapagtrabaho tayo araw-araw. Okay? And extreme external temperature. Kung masyadong mainit yung area, mas umiinit din yung katawan natin. Okay? So, in general, rectal temperature may be higher 1 degrees higher than oral temperature, and axillary temperature is 1 degrees lower than oral temperature. For the reason, because in rectal temperature, we are checking the core temperature of the body, meaning sa loob ng katawan. And pag external, pag axillary naman, sa labas ng katawan. So therefore, pag rectal, mas mataas, pag oral, pag axillary, mas mababa. Axillary is sa kilikili. Okay? And tympanic falls approximately midway between normal oral and rectal temperature measurement. So, tympanic temperature is yung temperature natin na kinukuha sa tenga or sa ears natin. Okay, so regulation of body temperature. Body temperature regulation requires the coordination of many body systems. For the core temperature to remain steady, heat production must equal to heat loss. Kung ano yung naproduce natin na heat, yun din dapat yung nawawalang init sa katawan natin. Pag nagkakaroon ng disequilibrium or nagkakaroon tayo ng imbalance between the heat produced and heat loss, doon nagkakaroon ng febrile or fever. The hypothalamus, which is located in the brain, particularly at the pituitary gland, is the body's built-in thermostat. That is the thermoregulator of the body. It is the hypothalamus. It can sense small changes in body temperature and stimulates the necessary responses in the nervous system, circulatory system, skin, and sweat glands to maintain homeostasis or equilibrium. Okay? So, heat production. The body continually produces heat as a byproduct of chemical reaction that occurs in body cell. This collective process is known as metabolism. Because the food that we eat will be converted into energy by metabolism. Kaya nga sinasabi nila, di ba, pag mataba ka, mababa kasi yung metabolism mo. Meaning, the food that you eat will not be converted into energy. Otherwise, it will be stored as fats in the body. Okay? Next is heat loss. Okay? So, what are the processes of losing heat? So, heat loss is through 4 processes. So, first is radiation, conduction, convection, and evaporation. So, I'll be discussing na lang sa inyo, pahapyawin ko na lang what is radiation, conduction, convection, and evaporation. So, radiation is pag malamig yung isang area, di ba? Lumalamig din yung katawan natin. That is radiation. For example, pumasok ka sa isang opisina na naka-full yung aircon, super lamig nung pinasukan mo. Di ba? Your body will become cold as well. Okay? Dumalamig din yung katawan natin. For example, di ba, nalami islang or panawin, tapos nagkumot ka, di ba, umiinit din yung katawan mo. Okay? Kaya nagkakaroon ng bumababa yung heat loss natin. Okay? Next is conduction. Conduction is the transfer of heat from one object to another. Meaning to say, yung ice, di ba? Masyadong malamig yung ice galing sa ref. Tapos, hinawakan mo ng hinawakan. Tapos, biglang lumamig na yung buong kamay mo. That is what we call conduction. Okay? Next is convection. Convection is the loss of heat through air currents such as from a breeze or a fan. Okay? O, intutok mo matibagim. Ijay aircon or intutok mo di bagim di electric pan, nawawala yung init ng katawan natin. That is convection. Evaporation is through diaphoresis or what we call sweating. Nawawala yung init ng katawan natin through sweating. So what are the factors affecting body temperature? First is age. Okay, newborn have unstable body temperature because their thermoregulatory mechanism, which is the hypothalamus, is immature. Therefore, ang mga bata, pag mainit, sobrang naiinitan. Pero pag malamig, sobra namang nalalamigan. Okay? It is not uncommon for elderly person to have body temperature less than 36.4 degrees centigrade, because normal temperature drops as a person ages. So, di ba, ang sinasabi na, nung bumakit ka, aglalamin ka. Yun. Okay, remember this fact when evaluating low-grade temperature in the elderly or identifying those at risk for hypothermia. Okay, hypothermia is lower than 36.5 degrees centigrade. That is hypothermia. Other term for pyrexia fever is hyperthermia. Okay? Environment. Ordinarily, changes in environment do not affect core body temp, but core body temperature can be altered to exposure of extreme, masyadong mainit na panahon or masyadong malamig na panahon. It will alter, okay? It will alter your body temperature. Okay. Next is time of the day. Time of the day, usually, pinakamababa, lowest temperature natin is at 3 a.m. and highest temperature natin is 5 p.m. I mean to 7 p.m. because of what? Yung extreme work na ginawa natin sa maghapon. Okay? Sa maghapon natin na pagtatrabaho, sa paghapon na pag-aaral. Okay? Yon. Yung pahinga mo, that will be the time na masyadong mataas yung beating of the heart and everything. So, nagkakaroon ng increase of temperature. Next is exercise. Siyempre, pag nag-exercise tayo, there will be an increased metabolism of the body because of the breakdown of carbohydrates and fats that will turn into energy. Okay. Stress. If you are stressed, the stimulation of the sympathetic nervous system, which will cause now the high level of epinephrine and norepinephrine, causing now higher temperature. Okay, hormones. I have already told to you a while ago. So the one that is responsible for the increasing of the temperature is the hormone na progesterone. So, how to assess body temperature? So, first, sights. Use judgment when selecting the route to measure temperature. So, there are 5. Mouth, ears, rectum, forehead, and axilla. Okay? Why that? Sabi niya, use judgment when selecting the route to measure temperature. So, for example, nakita mo na meron siyang singaw. Okay. Meron siyang mga mouth sores or may tubo sa bunganga ng pasyente natin. So, ang mga naman kukunin mo yung body temperature sa bunganga, okay? Nakita mong meron siyang fracture sa kamay at hindi niya maitaas yung kanyang kamay niya or yung kilikili niya, hindi niya maitaas yung kamay niya para maiipit niya yung thermometer. So, ang mga naman nakukunin mo ng temperature doon sa kilikili. Isn't it? So, yun ang sinasabi niya na in selecting the route, use your judgment. Okay? Oral. So, first is oral. The most common site for temperature measurement is the mouth. So what are the advantages? Oral route include easy access and client comfort. But if the patient, so pinaka-importanteng tatanungin mo is when is his or her last meal, okay, or last na kinain. So pag sinabi niya nag-igupnak gamin itinapudot nga sabaw, so wait for 15 to 30 minutes. As well as extreme cold, naghanak kami ti ice cream, so wait for 15 to 30 minutes. So, may not be prudent or safe for infant. Hindi daw to safe for infant, young children, okay? Baka kami matilmunda, okay? Unconscious or irrational client or client with seizure disorder. Yung mga epileptic client natin. Next is rectal. So, rectal temperature measurement, once thought to be the most accurate and commonly used clinically, has now been replaced by tympanic technology that is less invasive for the client. Client often do not tolerate rectal temperature, well, because of discomfort and embarrassment. Nakakaya naman kasi tutusukin yung puwet mo. Okay? If this route is used, take care to avoid placing the thermometer into fecal material, which may elevate the temperature reading falsely. Okay? So, this rectal route is contraindicated in diarrhea o agtaki, tapos kinuha mo pa sa puwet yung temperature ng client natin. Baka mapupuan ka, ikaw din. Rectal surgery, pag may mga surgery sa rectum, rectal disease, and may mga cancer. Hindi po pwede. Next is tympanic. To get an accurate reading, hold the pinna and gently pull the ear slightly upward and backward to straighten the ear canal. Okay? Fit the probe snugly in the client's ear canal and angle it toward the jaw line. Okay? So, that is the proper way on how to check the temperature using a tympanic. Okay? Next is temporal or artery. So, temporal artery or the forehead. Ito yung mga nilalagay natin, like yung nilalagay natin na cool fever, pero ito is strip lang yung nilalagay natin. Okay? Measurement do not appear to be affected by perspiration and are consistent when taken on either the right or left side of the forehead. The axillary route, next is axillary route is considered the least accurate and least reliable site because several factors can influence the measurement obtained. For example, kakaligo lang ng pasyente, okay? Tapos, yung friction, di pa nang ipit niya, it may alter the result because friction can cause heat, okay? Nagiging false positive yan. Okay? So, what are the equipment? So, electronic thermometer. Okay? Next is the tympanic membrane thermometer, disposable paper chemical thermometer, and the glass mercury thermometer. Itong glass mercury thermometer na to, hindi na ito masyadong ginagamit. Okay? It is not being used na. Okay? Sa mga client natin. Kasi nga, yung nakakatakot na mercury. If the mercury will be, the thermometer mercury will break, that will be too risky for our client and as well with you na kumuha ng temperature. So, for the meantime, temperature muna tayo.